Good morning, everybody. Good morning. Good morning. It's just great to see everybody here once again. Nice, chilly Washington morning, post-spring. So we're anxious to have what I know will be just a wonderful meeting of the next day or two. So I'm Bernie Rosof, Chair of the Institute of Medicine Roundtable on Health Literacy, and I'd like to welcome everybody here to today's workshop. I also want to let everyone know that this meeting is being recorded and it's being videotaped for webcast across the internet and across the nation, as I do believe. The mission of the Roundtable on Health Literacy is to inspire and activate a wide variety of stakeholders to develop, to implement, and share evidence-based health literacy practices, and also policies with the goal of improving the health and the well-being of all people. As one of its major activities, the Roundtable sponsors workshops for members and the public to discuss issues of importance and concern. The proliferation of consumer-facing technology and personal health information technology has grown steadily over the last 5 years and certainly exploded in the last several. Many people have embraced smartphones, although I heard this morning that some still have not, and wearable health monitoring devices to track their fitness and personal health information. Many of my family and many of my good friends have done just that, except me. Providers have made it easier for patients and caregivers to access health records and communicate through online patient portals. However, the increased amount of information can also lead to an increased amount of confusion on the part of users and caregivers. Let me reference a very timely New York Times article that appeared this past Sunday, just 2 days ago, by Bob Wachter, who was a long-term friend of mine and a proponent of patient safety, quality, and improvement. This article focused on EHRs, but the title is Why Healthcare Technology is Still So Bad. I do take issue with many of his commentary and did make note of these in a personal email that I sent to Bob a couple of days ago. But he speaks of the productivity paradox of information technology, the lag between the adoption of technology and the realization of technology gains, the principle of user-centered design, which has been woefully lacking in healthcare software redesign, and the need for better collaboration between academic researchers and software developers, better collaboration between academic researchers and software developers. He asks a very important question: what would be an ideal future? And he answers, when we have a technology that physicians suddenly cannot live without. I amended that to some degree by saying that physicians, patients, and the healthcare team cannot live without. So he's already answered my email saying that he couldn't do very much with 1,200 words. The purpose of this workshop is to explore health-literate practices in health IT and provide and consider the ramifications of this rapidly growing field on the health literacy of users. The workshop was organized by a planning committee whose members are Susan Backen, Gillian Christie, Garth Graham, Linda Harris, Pamela Jeffries, Andrew Pleasant, and Ted Vicky. I want to alert at this time the Roundtable members to be thinking very carefully as the day goes on about key points you think are important to highlight. At the end of the day, I'll be asking everyone, each of you, to provide us with 1 or 2 sentences about important points that were made. Sort of, what have we learned today? To start off the workshop, we are going to hear an overview on consumer-facing technology from Ted Vicky, who's the founder and president of Fitwell, LLC. Fitwell is a fitness management consulting company specializing in operations design, consulting, and professional development to the fitness industry, to government agencies, to Fortune 1000 companies, and the golf industry. We did that last, the golf industry. That's right. A more complete bio is available in the handouts, and I would suggest that you read it. I'm quite impressed with what Ted has accomplished in the field that he's in. I must say also, Ted, you made me feel very uncomfortable this morning and somewhat guilty for not having done my morning exercise. And I've already told Lila that next time we have to start this meeting a half hour later or else I'll just have to miss breakfast. Ted, for you.